Imagine doing everything right. Attending your medical checkups, getting regular cancer screening, receiving reassuring results every time. And then, one day, doctors tell you cancer has already spread throughout your body. How is that even possible? This is the heartbreaking story of a 33-year-old woman whose hidden cancer fooled almost everyone until it was too late. She was only 33 years old, a mother, living an ordinary life. She had high blood pressure but was otherwise functioning normally. She did something millions of women are encouraged to do. She attended regular gynecological checkups. She even had routine pap smear tests. Each one appeared reassuring. Everything seemed normal, or so everyone believed. Then, something changed. She started losing weight. Not because of dieting, not because of exercise. The weight simply disappeared. Soon after, she developed persistent fever. Then she noticed painful lumps around her neck. Another lump appeared beneath her arm. Then another. And another. Before long, new lumps were appearing in her thigh, and even inside one of her breasts. Doctors knew something serious was happening, but they still didn't know where it started. Then even stranger symptoms appeared. She struggled to open her mouth. Doctors call this trismus. Let's break that down. Trismus simply means the muscles that help open your jaw become tight or stiff. It can make eating, talking, and even swallowing extremely difficult. Soon, swallowing itself became painful. Doctors call that dysphagia. Dys means difficulty. Phagia means swallowing. In simple terms, food could no longer pass down normally. Something was spreading throughout her body. But from where? Doctors ordered ultrasound scans, CT scans, blood investigations, and biopsies. A biopsy simply means removing a tiny piece of abnormal tissue so doctors can examine it under a microscope. The results were confusing. The cancer cells looked aggressive, but they didn't clearly reveal where the original cancer had begun. Even advanced laboratory testing, called immunohistochemistry, couldn't immediately solve the mystery. Let's simplify that. Immunohistochemistry is a laboratory technique that uses special proteins called antibodies to identify certain markers on cancer cells. Think of it as a molecular fingerprint that helps doctors trace where a cancer started. Unfortunately, this fingerprint pointed in several different directions. Doctors initially suspected the cancer may have started somewhere else entirely. Meanwhile, the disease kept spreading. Her condition deteriorated rapidly. Fluid accumulated around her lungs. Her breathing became difficult. More swollen lymph nodes appeared. The cancer invaded muscles, the thyroid gland, the breasts, the adrenal glands, and many other organs. Doctors call this metastasis. Let's explain that. Metastasis means cancer cells have broken away from the original tumor, traveled through the blood or lymphatic system, and established new tumors in distant parts of the body. Once cancer becomes metastatic, treatment becomes much more challenging. Before we continue, if you enjoy real medical mysteries explained in simple language, subscribe to Health Casefile. Every week we uncover hidden diseases, unusual symptoms, and real medical cases that could one day save someone's life. Now, back to today's mystery. Despite extensive testing, the primary cancer remained hidden. Sadly, her condition worsened. Her immune system became overwhelmed. She developed severe infection. Doctors call this sepsis. Let's simplify it. Sepsis is the body's overwhelming and dangerous response to an infection. Instead of only fighting germs, the immune system begins damaging the body's own organs. Without immediate treatment, sepsis can become fatal. Soon afterward, her lungs also became severely damaged. She developed respiratory failure. Eventually, despite every effort, she died. But the biggest surprise came after death. Doctors performed an autopsy. An autopsy is a detailed medical examination performed after someone dies to determine exactly what happened. During the examination, they finally discovered the hidden source, a relatively small cancer deep inside the cervix. Not on the surface, hidden underneath healthy-looking tissue. Doctors call this an endophytic cervical cancer. Let's break that down. Endo means inside. Phytic refers to growth. Instead of growing outward where it can easily be seen, this cancer grew inward, deep into the cervix. That made it extremely difficult to detect during routine examinations. Even the cervix looked almost normal from the outside. And that's why the cancer escaped detection while silently spreading throughout her body. Doctors identified the cancer as squamous cell carcinoma. Let's simplify that. The cervix is covered by flat protective cells called squamous cells. When these cells become cancerous, the condition is called squamous cell carcinoma. It is the most common type of cervical cancer worldwide. One important lesson from this case is that screening dramatically reduces the risk of advanced cervical cancer, but no screening test is perfect. Rarely, certain cancers can grow in unusual ways, making them harder to detect early. This case represented one of those uncommon situations. So, who is at greater risk of cervical cancer? Persistent infection with certain high-risk types of human papillomavirus, or HPV, is the single biggest risk factor. Let's explain HPV. HPV is a very common virus spread primarily through intimate skin-to-skin sexual contact. Most infections disappear naturally, but some high-risk HPV types, especially HPV-16 and HPV-18, can persist for years, gradually damaging cervical cells and eventually causing cancer if left untreated. Other factors that may increase risk include smoking, having multiple sexual partners, early sexual activity, long-standing HPV infection, weakened immune systems, missing regular cervical screening. Can cervical cancer be prevented? In many cases, yes. Here are some of the most effective ways. Get vaccinated against HPV before exposure whenever eligible. Attend routine cervical cancer screening as recommended in your country. Follow up promptly if screening results are abnormal. Avoid smoking. Practice safer sex, including reducing exposure to sexually transmitted infections. Seek medical evaluation for persistent abnormal vaginal bleeding, bleeding after sex, foul-smelling discharge, unexplained pelvic pain, or unusual weight loss. Never ignore symptoms simply because a previous screening test was normal. This case reminds us that medicine is powerful, but not perfect. Most cervical cancers are highly preventable. Many are completely curable when detected early. But occasionally, a hidden cancer behaves differently, quietly, aggressively, and silently, until it reveals itself far too late. The good news is that most women will never experience this rare situation. Vaccination, routine screening, early medical evaluation, and timely treatment continue to save countless lives every single year. If you learned something from today's story, subscribe to Health Casefile. Because every symptom tells a story. Every disease leaves clues. And sometimes, understanding those clues can save a life. Disclaimer: this video is for educational and health awareness purposes only. It is not medical advice. Always consult a qualified healthcare professional regarding your health.